To give us more insight into how weight loss drugs are affecting fertility, we're joined by Dr. Allison Rodgers, Director of Ambulatory Surgery at the Fertility Centers of Illinois. Dr. Rodgers, thanks so much for joining us. And look, I got to tell you, I had no idea about this, and I like to think I kind of follow the news pretty closely. Talk to us a bit about GLP-1 drugs like Ozempic. I guess some people consider it a magic bullet or medication, but clearly there seems to be reason for some caution out there.
Absolutely. So this is a fantastic class of medication. It has been around for quite some time, up to some of them, the original ones, up to 20 years. Now, not Wegovy and Ozempic, but a lot of them, Ozempic came on the market in 2017. So it's not a new medication. What's new is using it for weight loss, which is a sort of new indication for this class of medications. And people who have diabetes, not always, but often are obese, and it's paired with difficulty losing weight. And these medications can be very effective, as effective as weight loss surgery, which obviously has, risks of itself.
Sure.
In terms of helping patients get down to a more normal weight. Obviously, we have an obesity epidemic in the United States. It causes major issues such as diabetes, high blood pressure, cardiac disease, heart attacks, all of those things, right? So it is great to be having people try to become a normal weight, and using medications like this can be very helpful. What we need to be really careful about is making sure that people are doing it safely around conception.
Explain more about that. Have you had any personal experience with female patients who have been taking these weight loss drugs?
Yeah, absolutely. So because of the warning label, and that warning label is not, obviously it hasn't been studied well in human pregnancies, but what we do know is that in animal models, especially rats, we see pretty serious birth defects. And so because of that, and because it stays in your system quite a while, it's a once-a-week injection, the recommendation is to stop taking these medications 2 months before trying to get pregnant. And I've absolutely had patients who have gotten pregnant while on these medications. Obviously, it's important to stop those medications right away. Organ development in babies and embryos, most of all of organ development happens in the first 2 to 3 months. And that is a lot of times before people even know they're pregnant. And that is another reason to stop these medications, if you're trying to get pregnant.
Wow, that would be an obvious safety concern for pregnant women or people trying to get pregnant. Let's talk about the medications that are currently used to treat infertility in women and their success rates.
Yeah, so it's really, this segment really talked a little bit about PCOS in general. And PCOS is a metabolic disorder, similar to diabetes in terms of the fact that there's issues with insulin resistance, right? And so we do use some diabetes medications in patients who have PCOS. So the one we think about is metformin or glucophage, and it is a medication that makes your body more sensitive to insulin, and it's used in patients with PCOS to help them get pregnant. Now, obviously, those medications don't always help patients with PCOS ovulate or release eggs. So there's other medications we can use to help them actually release the eggs. So the medication that most people will use is a medicine called letrozole or Femara, or a medication called clomiphene or Clomid. And these are medications that actually help patients with PCOS grow eggs. Obviously, we also have injectable medications.
Okay, so what's the likelihood of FDA certification for so-called weight loss drugs, injectables for PCOS treatment?
I think that it's a very slippery slope, and I think that there needs to be more studies done to see if it actually reverses the symptoms from PCOS. I would say that if you are somebody who has PCOS and you're losing weight, you're not on contraception, you should probably be on reliable contraception. We just heard that it can delay sort of absorption and have difficulty with absorption. Obviously, with oral contraceptions, pills, that can be a problem. We don't have a lot of studies showing that Ozempic or Wegovy, Mounjaro decrease the chances of, birth control pills being effective. That's more of a hypothesis, not well studied yet. But there's lots of other types of birth control, right? So there's things like IUDs, other, transdermal applications that can be more helpful.
Okay, before you go, I want to ask you about these surprise pregnancies. Are you concerned that people trying to take these weight loss drugs could be opening themselves up to a surprise pregnancy. We heard the one doctor say 53-year-old with twins. I'm pretty certain the 53-year-old wasn't prepared for that.
Yeah, I would agree. What I would say is that, I think, and I've absolutely, as a TikTok, creator myself, I'm on TikTok a lot. I've
Sure.
definitely seen people, including doctors, say, yeah, take Wegovy, take Ozempic to get pregnant. And these are not fertility doctors, okay? I'm not sure what kind of doctors they are, but they clearly are not doctors that know the data,
Yeah.
right? So the data says it can cause birth defects.
Yeah.
We do not want patients who are trying to get pregnant on these medications. So controlling weight's really important. I usually recommend patients stay on it, but have reliable birth control while you're on it.